Spectrum Health Center for Integrative Medicine is a multi-specialty clinic that employs a new model of care to assess and treat high-frequency patients. The Center for Integrative Medicine aims to identify, accurately diagnose, and stabilize each patient. Here to tell us more about it is Dr. Cara Poland. Thanks so much for being here with us.
Good morning.
And I think the big word there is frequency, the patients that are there all the time. So tell us a little bit more about the history of how this all came to be.
So this clinic was initially started by a gentleman named Dr. Corey Waller. He is an ER doctor, and he started the clinic based on his experience in the emergency room, which was that people were coming very frequently and they weren't getting the care that they needed, and they didn't have access to the primary care services in an office that they would benefit from. So he started with a small group of about 30 patients and tried it out, set up a clinic with a team of assistants, including a social worker, medical assistant, to help him navigate the system. And what they found was that these patients had a much better outcome. They were using the emergency room less, and it actually ended up saving the hospital and the healthcare system about $1 million.
Wow. So I'm guessing those patients too were kind of clogging up, in a sense, the emergency room too, right? In a sense?
In a sense, definitely. Yeah. These are patients that were visiting the emergency room 10 or more times in each year. Wow. So they were what we call high utilizers of the emergency room. And the emergency room really isn't the best place to get the type of care that they were looking for.
Yeah. If you could allude a little bit more on the types of patients that actually come to this center.
So the patients are very complicated patients. They often have complicated diagnoses, difficult situations in the social sector. They often are homeless and in high need. So we in the clinic are able to look at the whole patient and look at them from a biopsychosocial model, which enables us to look at what their challenges are at home, as well as what their challenges are in the healthcare arena, and try to blend those. So one of the things we're very fortunate to have in our clinic is a great team that's set up by a lot of our community partners. So not only through Spectrum Health, but also through Priority Health, through Network 180, and through Molina Health, all contribute to our clinic, which gives us a lot more resources to provide our patients with the complicated needs that they have.
Yeah, you're really able to dissect it. It sounds like this isn't just coming in, writing your prescription and going. You really need to sit down and take apart what exactly is causing all of this.
Yes, and so we also get extended time period with our patients, so we can have up to an hour with each patient for a regular office visit, and most other physicians, for a comparison, get somewhere between 15 and 20 minutes.
Wow. What's involved with the care guide that your team actually has? So
we develop a care guide that we also try to distribute to the local area emergency rooms. So we work with our partners at all of the hospitals, so not just Spectrum's Butterworth and Blodgett hospitals, but also with Metro Hospital and St. Mary's Hospital, to ensure that when these patients do need to go to the ER, or if they do show up at the ER, the doctors there are also aware of what we're doing and what might be best for the patient.
I think you're a great example. Let's go ahead and talk a little bit about what you specialize in.
So one of the common threads for a lot of these patients is that they are having difficulty in part because they have a substance use disorder. So my background is that I'm a general internal medicine doctor, born and raised and trained in Michigan, and then I did go to Boston for fellowship training in addiction medicine. So I'm one of the first in the nation to have that specialty training, and proud to be one of the first 3,000 addiction medicine physicians that are board certified in the United States.
Wonderful. That's a great accomplishment. Okay, we got to tell people where your center is located.
So the center is located at 75 Sheldon, right by the Children's Museum downtown, and the phone number is area code 616-391-6120.
All right. Well, thank you so much. You're giving us some great insight on this wonderful and needed program. Thank you so much for being here.
Thank you.
Absolutely. All right.